Hi, welcome to OneMedicine. Today we'll talk about liposuction and fat transfer. Liposuction, it's also called as liposuction surgery or suction assisted lipectomy or suction lipectomy, also called as suction lipoplasty or fat suction. So basically, it's a surgical suction of the subcutaneous fat through cannula, which are inserted through small skin incisions. In this procedure, we take out the subcutaneous fat through cannulas inserted through the skin incisions. It's a safe procedure and it can be performed as a daycare procedure. One of the recent introductions here is we have tumescent liposuction, which is introduced these days, and that was firstly introduced by a dermatologist called Dr. Jeffrey Klein. So this was the person who introduced tumescent liposuction. He's also called as the father of liposuction for the same reason. So the principle behind this procedure is initially when anyone gains weight, there'll be only increase in the fat cell size. But as the person continues to gain weight, there'll be increase in fat cell number also. So when you try to reduce weight, your fat cell size will decrease, but the number won't decrease. So to treat this resistant fat, we do liposuction. So liposuction will reduce the fat cell number and also resistant fat. That's the only advantage of doing liposuction here. Okay, and this is not done as an alternative to diet and exercise. This has to be done together. Like the diet and exercise should be continued even after the patient has undergone liposuction. So the mechanisms here is there'll be removal of the fat cells by suction or damage to the fat cells by to and fro motion or through powered devices can be used and the through vibration, and that will help in dissolution of the fat, or ultrasonic devices and laser lipolysis. These are the several newer techniques which is introduced to reduce the fat. So here is the cannula which is inserted inside the subcutaneous tissue wherein some energy generated here or suction is used to take out the fat. So you can see the subcutaneous fat is reduced in amount after liposuction. So the we have cosmetological and non-cosmetological indications for doing liposuction. The cosmetological indications is this is for resistant fat. It is which is actually not responding to diet and exercise. Diet and exercise has to be the first approach, but it is not an alternative to diet and exercise. So that has to be continued even after you have undergone liposuction for resistant fat. So the diagrams here tells you the sites where liposuction can be done. Here you can see the lower face, cervicomental angle, submandibular region, axillary folds, breast, upper abdomen, periumbilical area, lower abdomen, thighs, knees, medial knees. These are the sites where it can be done. Here you can see the posterior axillary fold, iliac crest, the flanks here. So these are the even the arm fat can be removed, ankles and calves. So there it can be done. Non-cosmetological indications would be we have lipomas, a disorder wherein there will be collection of subcutaneous fat called lipomas, or familial multiple lipomatosis, adiposis dolorosa, also called as Dercum's disease. Here in postmenopausal women, there will be depositions of the subcutaneous fat here. Gynecomastia, enlargement of male breast. Pseudogynecomastia, here there will be enlargement of breast because of fatty accumulation of tissue. Here glands will be accumulated. So there also you can do liposuction. Insulin-induced hypertrophy, buffalo hump because of Cushing syndrome, HIV or antiretroviral therapy induced lipodystrophy. So there are many drugs which are used in ERT to treat HIV, wherein lipodystrophy is one of the side effects that can be treated with this. Axillary hyperhidrosis also. In axillary hyperhidrosis, you destroy the eccrine apocrine glands which are present in the axilla by liposuction. Not you don't take out all the glands present there, but the reduction in the number of the glands present also will decrease hyperhidrosis or sweating. Undermining flaps or lymphedema, which is post-axillary lymphadenectomy, also can be taken care of by liposuction. So these will be the non-cosmetological benefits of liposuction or indications or uses. So here you can see the gynecomastia, which is reduced in a great amount after liposuction is done. Methods, we have liposuction surgery. In that we have conventional liposuction, which is no longer followed now. It was done under general anesthesia and increased complications were seen because of general anesthesia as well as the procedure also. Microcannular tumescent liposuction, which is followed now. It's called microcannular because we use small 1 to 2 mm sized cannulas. Tumescent because we use a fluid, and that fluid is called tumescent fluid here. Tumescent basically means swollen and firm. Here you use a fluid which has many constituents like sodium bicarbonate or adrenaline and lignocaine. We use it and insert it, or you infiltrate that fluid in the subcutaneous fatty tissue, and that will make the fat firm and swollen, and that's why it is called tumescent fluid. Liposuction because you're taking out the fat. Powered liposuction also can be used, which will vibrate the cannula inserted and then take out the fat. Using energy devices are laser lipolysis, ultrasound lipolysis, and cryolipolysis. Cryolipolysis is cold induced injury. Ultrasound would be thermal induced injury of the subcutaneous fat. So the conventional liposuction which was done before was done under general anesthesia, and around 10 liters of fat was removed in one sitting, and it was a quick procedure. But it needed a longer hospitalization period, and there were complications associated with general anesthesia as well. Larger cannulas were used to suck out the fat. Therefore, the scars also formed in that particular site, and the recovery was very slow. Because of all of these reasons, we have abandoned this procedure. Nobody does this anymore because complications of general anesthesia would be more here. Now we follow microcannular tumescent liposuction. So the tumescent word means swollen and firm. Microcannular will be you use cannulas which are less than 0.5 mm. These cannulas you use to infiltrate the tumescent fluid inside the abdomen or wherever the site is. So the procedure is you have to, if suppose this is the abdominal area, you have to treat the subcutaneous fat in this area. You have to clean the area. Lignocaine with adrenaline you can give wherever you're making incisions. So you incise the skin, like small incisions of 1 to 2 mm you do, and you take a cannula and you insert the cannula in these particular incisions. Okay, and this cannula will be connected to a bag which has tumescent fluid. So this tumescent fluid will be infiltrated inside the abdomen. So the tumescent fluid will be inside the abdomen, and this will make the abdomen swollen and firm. That is the end point of tumescence. The fluid is also called as clean solution. The tumescent fluid is also called as clean solution because Jeffrey Clean was a doctor who introduced that solution. Okay. So after this is infiltrated, the skin will become swollen and firm. You can no longer grasp the abdominal skin. That's just the end point. Then you have to wait for 30 minutes after that. So that will cause detumescence. That will go back to its original state. Then the fat would have dissolved. Then you suction it out through small cannulas. You insert another cannula and suction it out. After suction has been done, you have to leave the suction sessions open. That will heal by secondary intention. The fluid will continue to drain out of that small holes that you have made. For that you have to apply compression bandage. 2-layer compression bandage has to be applied, and then it's a daycare procedure. The patient can go home after that. There's no admission. Whole procedure will take around 3 to 5 hours. Power assisted would be you use a vibrating reciprocating cannula here, which again will have increased rate of infiltration. Easier and quicker extraction is seen with this. It decreases the work and duration of the procedure also will be reduced by using power here. In tight areas like in periumbilical area, you can go for power assisted liposuction. Okay, vibrating cannulas can be used here. So this is the powered machine. This is the aspiration machine. This is the infiltration machine here. And here you can see the cannula, which is again vibrating inside the subcutaneous tissue. Easy removal of fat will be seen. Ultrasound assisted liposuction. Here using thermal energy we damage the fat cells and facilitate removal. You can see the cannula inserted in the subcutaneous fat and breaking down the fat here. The side effects, again, you're using a thermal device. So there can be burns, small cyst formation with fluid inside it called as seromas can be formed. New machines are introduced now which have lesser side effects. That's the advantage of this. But it is expensive again. So more side effects, less expensive. But if the side effects are less, then the procedure would be more expensive again. Laser lipolysis. Here we use a laser fiber as a free beam to lace the fat. Either laser lipolysis is done alone, that only this procedure is done, or it can be done subsequent to liposuction also. So different lasers we use like 980 nanometer, 1330 nanometer lasers, Nd:Arc lasers are used here. It will destroy the fat also. It will reduce the blood loss which is seen with conventional liposuction and induces skin tightening also. So we have a better response with this. Smaller areas like chin can be done with laser lipolysis. Now we'll go to tumescent liposuction, which is one of the very important liposuction procedures which is done. People have this notion that liposuction shouldn't be done. It's a very dangerous procedure and all of that. But till now, no death has been reported with tumescent anesthesia liposuction. So it's one of the safest procedures that is available now. Cost-wise also not very costly. It was introduced by the American dermatologist Dr. Jeffrey Clean in 1987. That's when he introduced this technology. Infiltration of a dilute solution of this clean solution or the tumescent fluid will have lidocaine and epinephrine. Okay, it is performed under local anesthesia. The whole procedure is under local anesthesia. There is no need for sedation also. It has minimal side effects. It's a remarkably safe procedure. Upper dose of lidocaine used in the solution is 6 mg per kg, but it can be also 45 to 55 mg per kg of lignocaine which can be used in this procedure. The tumescent fluid will have lignocaine, Then it will also have epinephrine. It will have NaHCO3, sodium bicarbonate, and it will be diluted in normal saline. So these are the four constituents of the tumescent fluid or clean solution. So this LA that you use is because of the anesthetic effect that you want while doing the procedure. And the advantages for its slow absorption of lignocaine is the subcutaneous fat has very low amount of blood flow. So therefore absorption of lignocaine and risk of lignocaine toxicity is also less. And lignocaine is lipophilic and is easily sequestered in the fat. So there is easy sequestration of lignocaine in the fat. And diluted epinephrine is used in the solution. Therefore that will cause vasoconstriction and decrease the systemic absorption also. Advantage here. And large volume of this tumescent solution itself is will cause compression of the blood vessels hydrostatic pressure. So there's no absorption happening. And the very low dilution of lignocaine is used in clean solution, which does not achieve the gradient for systemic absorption. And most of the solution is removed while you suction out or during aspiration it is removed. So minimizing the duration available for absorption. So because of these reasons, we say that lignocaine can be safely used as an anesthetic agent in tumescent liposuction. Lidocaine percentage is 0.05 to 0.1%. That is for anesthesia use. Epinephrine is 1:10 lakh to 1.5:10 lakh is the concentration. You use it for vasoconstriction. And NaHCO3 use because lignocaine is acidic. To increase the pH, we use NaHCO3, sodium bicarbonate, because this will cause stinging and pain it will cause. So to reduce that, you can use it. And the diluent you use is normal saline can be used as a diluent. So this is the constituents of the clean solution or tumescent fluid that we use to infiltrate the area. Advantages is complete regional anesthesia is without the need for nerve blocks. This local anesthesia will persist for up to 24 hours after the procedure. Therefore, for post-operative analgesia also it is helpful. It will minimize the blood loss because epinephrine is causing vasoconstriction. Minimal post-operative bruising, rapid post-operative recovery is seen with this. Smaller cannulas are used in this procedure. Therefore, the irregularities of skin scarring also won't be that much. And there is reduced anesthetic risk because you're using LA and you're not using general anesthesia or inhalation anesthesia is not used in this procedure. Patient selection, ideal candidate is those who have localized deposits of fat and there is no significant medical problem, realistic expectation they should have. Contraindications would be if the patient has any patient that you select for liposuction, he should be properly counseled and he should have a good lifestyle because even after the procedure, diet and exercise is a must. So a mentally sane person who is ready to diet and exercise even after that, who is motivated enough and who does not have any unrealistic expectations from the procedure can be taken up. Okay. The contraindications would be absolute as if he has severe obesity and if he's seeking this procedure as a weight loss procedure, if there's body dysmorphic disorder, if there's untreated psychiatric illness, if there's excessive scarring in the area that has to be treated, you can't go for this procedure. Relative would be if he has moderate obesity, poor wound healing, hypertrophic scar, keloidal tendencies, coagulation or bleeding disorders, allergy to lidocaine if he has, if there's adverse reaction to epinephrine, and medical illness and psychiatric illness. In these conditions, you have to weigh the risk versus benefit and taken up to surgery. Contraindications again, excessively obese, diabetes, hypertension, cardiovascular, body dysmorphic disorder, pregnancy, and umbilical hernia again is an important thing that you have to take into consideration. Unrealistic expectations also is very important. Preoperative evaluation, different management options are there. Diet and exercise, you have to explain whatever options are there to him for weight loss before this. And diet and exercise, post-operative course, what are the complications that can be expected has to be explained. They have to still continue diet and exercise. Do not expect dramatic weight loss. Around 3 to 7 kg can be expected. Good medical history, the bleeding diathesis, infections, comorbidities, prior surgeries, LSAS history, everything has to be asked. Routine blood investigations and the coagulation profile is done, and one area has to be treated at a particular time. You have to take pre-evaluation photographs. Pre-op antibiotics, analgesics, antibiotics, and anxiolytics and clonidine is given. Surgical cleaning of the area is done, and topographical marking with ink because wherever you have to treat, you have to mark it prior. Vital signs like pulse oximetry and BP and pulse is checked along with saturation. Instruments that you use or that you need are infiltration cannula to infiltrate the fluid, aspiration cannula to aspirate the fluid, pressure cuffs for the infiltration of the tumescent fluid, then suction apparatus. So these are the different types of cannulas available to infiltrate. This is a suction machine, the suction cannula. So this is the infiltration pump here with the tumescent fluid. This is a suction apparatus to suction it out. Small holes are made. These holes are called as adits. The holes that you make in the treatment area are called as adits. These are about 1.5 to 2 mm in size. Small holes are made for the insertion of the cannula. They can also be made with the scalpel blade or with dermal punches. They can be made. Infiltration of this clean solution is done. 2 to 3 liters of the solution is infiltrated to make it firm and swollen. It will be difficult to grab the skin. Until then, you have to infiltrate and you have to wait for this. Will take around 1 to 2 hours. Then is detumescence, which takes 30 minutes for the fluid to percolate inside the subcutaneous fat, and it will decrease the firmness also, and you'll be able to grasp now. Now we have to aspirate after this using cannula. You have to avoid too much pressure while aspirating because it will cause dimpling and asymmetry of the skin. Advantage here is patient is awake throughout. He'll tell you if he has any pain. If you're injuring the muscle, he'll let you know. So that's one of the important things that you can expect. So here is the cannula inserted in the treated site. Patient can stand up immediately after surgery, and you can assess the symmetry of the procedure also. It will take around 90 minutes to 2 hours for the whole procedure. 2 to 6 liters of fat is removed and minimum blood loss of 30 to 50 ml. So more than 6 liters you can't remove because it will cause cardiovascular compromise if you're taking out so much fluid. And also 30 to 50 ml is the amount of blood loss that you should expect, not more than that also. And here the fluid that you get will be yellowish in color. If it is pinkish in color again or reddish in color, you have to expect the bleeding and you have to stop doing the procedure. Post-operative dressing and follow-up. Some fluid is left behind for anesthesia. You should that should be drained in next 3 to 5 days. You leave the insuction site open. You don't suture it. Okay, they're not sutured. They heal by secondary intention. Tight pressure bandages. You have to give 2 layers of these pressure bandages. Dressing should be changed for the first 3 days, and then for the first 3 days with increased pressure, you have to dress it 2 layers because for the fluid to drain out. After that, you can reduce the pressure, and for 2 weeks, dressing has to be done. He can resume work in 1 or 2 days. Heavy exercises after 10 days only. Full results can be seen after 6 weeks to 3 months. Here's the double layered pressure dressing that we do, and this is the post operative compression garments that they can use to maintain the contour and also to help in better drainage of the fluid. Possible complications that you can expect is they're very minimal, but they can be infection, hematomas, seromas, skin indentations, erosion, ulceration, thrombophlebitis. And these are very rare with the newer procedure, that is pulmonary emboli, fat emboli, and abdominal perforation is rarely seen these days. So this is the post-operative ecchymosis which was seen, which resolved later. Serious complications of conventional anesthesia not seen here. Pulmonary embolism, excessive fat loss, hemorrhagic necrosis, and death is very rarely, it's not at all reported. And newer techniques have lesser side effects. Here you can see the abdominal area treated. This is the post-procedure. Here you can see the flanks reduced in size and contoured. Here also you can see the procedure. This is the medial thighs which was treated. This is for axillary hyperhidrosis. Non-invasive technologies that we have these days are injection lipolysis. Here we inject deoxycholic acid or phosphatidylcholine to disrupt the fat cell membrane. High intensity focused ultrasound will cause thermal destruction. Non-thermal focused ultrasound is cavitation disruption of the adipocytes. Cryolipolysis is cold induced apoptosis of fat cells. Radiofrequency monopolar bipolar can be used for thermal destruction again. Low level light therapy also can be used for photochemical membrane pore creation. So these are the other non-invasive techniques using energy devices which can be done. It was done using phosphatidylcholine injection. The double chin is reduced. Next we'll talk about fat transfer. So here we use fat as a filler. Fat is said to be a natural filler because of its longevity, because of its stability, and because of the large amounts of fat available. They are also a source of stem cells which enhances the rejuvenating property. So they have broad application in as aesthetic as well as dermatosurgery. Fat was also used to improve the contour. Since 19th century it was used, and the first fat transplantation was done by Gustav Neuber. It was not used later as there was tendency to resorption. So there was this resorption of fat which was seen, and they formed cysts, and it was also replaced by fatty tissue. But in early 1980s, autologous fat injection and atraumatic technique were introduced, which were better. So the fat not only has adipocytes, it also has pre-adipocytes, endothelial cells, fibroblasts, and adipose-derived adult mesenchymal stem cells, which helps in soft tissue regeneration. So because of all of this, the fat is used as a filler these days. Advantages of using the fat is it is a natural substance and it's available in large quantities. There is no possibility of allergenicity or rejection, and it provides stem cells. So because of these reasons, fats can be used as a filler. The disadvantages is any surgical procedure will be associated with its complications. So here also we see some complications associated with the surgery, and sometimes there can be resorption of the fat also. Indications is it is used in aging seen in the face, that is, the aging changes seen in the face, like in the nasolabial folds, marionette fold, cheeks, malar region, or lips, chin, periorbital areas, and body like breasts or hands or buttocks, calf, penis, mons pubis, and vagina. And it is also used for treating post-traumatic depressed scars or surgical defects or post-liposuction depressions. The dermatological conditions can be treated like post-acne scarring, morphia, perirhombic syndrome, which is progressive hemifacial atrophy. So wherever there's wrinkling or atrophy of the skin, you can treat it with the fat transfer. You basically take out fat from one side and transfer it to another side where it is required. Where you do not do if the patient has DVT or deep vein thrombosis, pulmonary embolism, bleeding disorders, infections, medical problems like diabetes, hypertension, which have not been treated. Case selection, it can be done in either sex. Both males and females can undergo this. The patient ideally should be between ages of 30 to 50 years, and they should have minimal photo aging. Proper counseling before the procedure, photography before the procedure. So second touch-up can be done 3 to 4 months later if it is not satisfactory. Then prophylactic oral antibiotics prior the procedure has to be taken. The procedure involves 3 steps: fat harvesting, refinement, and fat replacement. So these are the instruments used here, the cannulas, the syringes that are used for harvesting the fat here. Okay, so these are the cannulas and the instrument that can be used. So fat harvesting, or it's also called a syringe harvesting. This is the syringe that we use for harvesting. That is also called as Luer lock syringe, which is used for harvesting the fat here. So the donor area can be a lower abdomen, thighs, or knees. Tumescent anesthesia again is here used, like we used it in tumescent liposuction. Area is cleaned with povidone and 10 cc with of 2% lignocaine with 1:2, like epinephrine is injected near to the site where you have to incise it. The harvesting equipment will be 3 mm cannula, which is 15 centimeter long, and it has distal holes. The cannula has distal holes for better suction or better infiltration. Okay, it is this cannula is attached to the syringe here. So the syringe would be attached to this cannula here. 2 mm stab incision is made on the area to be treated with a 11 number blade. So an incision is made in the skin, and then the cannula is inserted through the skin incision, which is moved to and fro. So here you get the necessary amount of fat. The necessary amount of fat is suctioned out. The syringe is removed and the site is covered with you have to cover the site. Again, you don't suture it, you just cover it. Refinement is harvested fat is refined into pure fat, which is around 10 to 90% of the viable fat. Refinement is done in centrifuge machines. It is done at 3000 rotations per minute for 3 minutes. So after you rotate it for so long, you will get 3 layers: upper layer, middle layer, and lower layer. You will get. So the upper layer will have only oil from the ruptured adipocytes, and you discard it. The lower layer will have blood and lignocaine. We don't want it. We discard this also. Only the middle layer is what is used. That is the viable adipocytes it has. So that is used, and these are again transferred into a Luer syringe for again transferring it. So replacement, here you've taken whatever necessary amount of fat you need and you have to attach it to the syringe again with the cannula. The fat is again it is grafting is done under local anesthesia only. 18 to 20 gauge needle you can use it. Correct placement of these in pre-surgically marked sites have to be made. You should make multiple incisions and insert it in multiple areas, because at one area of your insert there will be liquefactive necrosis. You should not do this. Multiple sites should be injected. Post-operative ice packs you can apply to reduce the edema and pain. Swelling will reduce in 2 to 3 weeks, and up to 6 weeks it will take. You have to avoid massaging the area wherever it is treated. It will last, once if it is done, it will last for 9 months to 3 years, and that's a longer period also. So here you can see a atrophy which was there. It was healed with the fat transfer. You take out fat from any other site, you inject it here. That's all. Complications, surgically associated complications like infection, hemorrhage, hematoma, ecchymosis will be there. Aesthetic complications like fat necrosis, nodule formation, cyst formation, post-inflammatory hypopigmentation can be there. Serious side effects are very rare. It can include fat embolism, infarction, blindness, and abscess. Blindness if you're dealing around the eyes. Right. So take care before doing the procedure, and even after the procedure, counsel the patient properly and do the procedure. It's a simple procedure but associated with very rare side effects. So take care of all of that. Tips for proper results is you have to harvest the fat. While suctioning out the fat, you have to take it out with low negative pressure because it will cause depression and wrinkling and dimpling if you are using a lot of pressure. Then proper refinement in the centrifuge machine and placing small amounts of adipocytes in multiple tunnels and maximize the contact with the surrounding tissue to prevent any liquefactive necrosis. Don't put all the fat in one site. That's about fat transfer.